he has it, she has it, maybe they have it too. In Hong Kong, there's about 700,000 people who are diabetics, about 10% of the population. Aside from Hong Kong, diabetes is a globally chronic disease, and by 2040, there'll be about 640 million people who are diabetics. Diabetes is a chronic metabolic disorder. It will damage your organs, including cardiovascular, retinal, nerve, and kidney damage. A Chinese university discovers that in every 6 patients, one will encounter acute renal dysfunction. High blood sugar will damage our blood sugar, our blood vessels, and in our kidney, the tissue in our kidney will turn fibrous and calcify, and causing our kidney function to decrease. And if blood pressure or blood sugar is not controlled properly, renal dysfunction will turn into kidney failure, which will require dialysis or kidney transplant. Sorry, there's a ad. Sorry, next ad. All right, I'm gonna skip. Here we go. Miss Wong, who has been diabetic for 30 years, goes to see her doctor regularly until 2 years ago. The body has severe edema and found protein in her urine. She was mentally confused and had difficulties moving around. From 142 pounds, she was bloated to 170 pounds. She was admitted to the hospital 3 times, and she didn't want to eat. Mrs. Wong has been diagnosed with acute renal failure. The doctors gave her many different prescriptions, like steroids and new blood sugar medicine and injectables. Omega is good for inflammation and heals kidney inflammation. This one is for mommy's weight is about 130 pounds, which is normal for her, and she stopped her steroids. So mommy is eating less blood pressure medication, but she's taking a lot more supplements. Stage 5 is renal failure. If she's not stable, then she'll be on dialysis. The best is stage 1. Stage 5 is the worst, and she's at about stage 3 and 4. And the doctor says she has about 30% left of her kidney function, but for her age, it should be fine. Diabetic kidney issue has no symptoms. You need the doctor to do a screening for you. But usually when the diabetic patient has, so the tissue in the kidney becomes compromised and damaged. So it'll become thicker, it'll calcify, and if it continues, you'll see that it'll become a condition of atrophy. So in the kidney, the most important tissue in the kidney will continue to be damaged, and at the very end, the whole kidney will be damaged, and that will be the end stage of kidney failure. Aside from using medicine and urine tests, high blood pressure will cause cardiovascular disease. So controlling blood pressure is very important for those with diabetes. A healthy blood vessel is smooth, but inside the vessel, the inside the vessel will be damaged if you're a diabetic. So there's all sorts of things that could damage your blood vessels, like high diabetes, those with high cholesterol, and those with this condition will cause your heart to fail. Also, kidney issue will increase the cardio or neurovascular disease, For your brain, it'll be a stroke, and then for your heart will be a heart attack, or when your body is not able to produce or use insulin, blood sugar will increase. And when your blood sugar is too high, your body will your body will have issues metabolizing fat and sugar. And by 10 p.m., your blood sugar is up to 11.2. How come? It was ringing at that time to warn me that my blood sugar was low. So I ate some bread. So I see that your blood sugar spiked. So today, when you woke up, your blood sugar was 6 point something. It's a little high. So the injectable is usually given before meal. So it really depends on what her levels are pre-meal. The machine is to check her blood sugar, and then the other one is to check her blood sugar to determine whether she needs to adjust her medication. So everything is flexible. So the doctor reminds diabetics that if their condition is not stable, the blood sugar in the body and the blood pressure will injure the kidney blood vessel. And over time, it will cause kidney disease. In the early and middle stages of kidney disease is not obvious. So many of them, when they find out, it's end stage. And a lot of them are from diabetes. So doctors will determine medication based on someone's body condition and their reaction to different medication. We will prescribe oral medication, injectables, medication like that. And now there are many new versions of diabetic medication. New versions of medicine will not only control blood sugar, it'll also decrease complications of the heart and the kidney to maybe up to 30 to 40%. At the same time, it will decrease the chances of heart failure, neurocardiac disease up to 30%. Even though there's no way to cure diabetes, but with controlled diet, diabetics can have a good life too. So Ms. Wong says you have to be aware of the glycemic index of different foods. So diabetics can eat smartly too. So my mom will measure the glycemic index for different foods that she takes. So grains will maintain her blood sugar well. So eating white rice or Japanese fruit will cause her blood sugar to spike. So fruits are not good for her, like grapes and pumpkins. So we have to avoid this type of food. Diabetic kidney damage, those with diabetic kidney injury, they have to be careful about what they eat. They have to eat low sugar and low oil diet just to ease on the amount of work for the kidney. So every meal they should eat 0.6 to 0.8 grams of protein because with too much protein, it gives the kidney extra work. So they have to avoid it. And they have to avoid star fruit because it contains a neurotoxin that requires the kidney to filter out of the body. And those with kidney disease who cannot do this might be poisoned. Those who think they avoid carbohydrate may experience worse outcomes. If the diabetic avoids carbs, it might affect their metabolism. It might cause them to lose their muscles, and they might experience insomnia. So even diabetics should eat a balanced diet so they can control their blood sugar and to avoid kidney failure. And also eating a healthy diet will help them intake more nutrition to keep your body healthy.